DeepSeek versus ChatGPT. We are going to witness the ultimate duel between these two heavyweights right now, right here. We are going to keep score, and we are going to see who comes out on top. For those of you that are aware, DeepSeek is one of the latest language models to be unleashed on the earth, and it is causing quite a disruption because it is so good at what it does, particularly when it comes to deep thinking and reasoning. As you also know, ChatGPT is a heavyweight here and is probably the most well-known language model that we have, and I use both of these all the time. Today, we are having a competition between these two heavyweights, and we are going to find out who comes out on top. I'm going to be asking them questions about education, about social media, about marketing, about communication, about advanced medical topics, and we're going to see who comes out on top. And not only that, we are going to keep score. And with that being said, let's create a little scorecard right here. On this side, we're going to have DeepSeek. On this side, we've got ChatGPT. And if you want to, feel free to keep score along with me because we are going to see if you agree with who comes out on top. So let's jump into some of these questions. The first thing that we are going to ask each of these models is to explain a Botox treatment in simple terms. Simple, friendly way. Let's see who does better. DeepSeek, what do you have to say to this? DeepSeek says, sure. Botox is like a tiny helper that can smooth out wrinkles and fine lines on your face. It's made from a natural protein that temporarily relaxes the muscles that cause those lines when we make expressions like frowning or squinting. It's not permanent, usually lasts a few months, and it's super quick, often called a lunchtime procedure because you can get it done during a break. People love it because it can make skin look smoother and fresher, but it's important to get it done by a trained professional to make sure it's safe and looks natural. Think of it as a little boost to help you feel confident. All right, I like it. Not too bad. It's simple, it's friendly, pretty good. Let's have a look here with ChatGPT and see what ChatGPT comes up with for this particular question. Botox is like a little pause button for your muscles. It's a purified protein that relaxes the muscles that cause wrinkles, making your skin look smoother and more fresh. It works by blocking the signal from the nerves to the muscles so they don't contract as much. This helps soften lines like forehead wrinkles, crow's feet, and frown lines. The result? A natural, more relaxed look, not frozen, just refreshed. It kicks in after a few days and lasts about 3 to 4 months before gradually wearing off. And no, it won't change your face. Just make it look like a well-rested version of you. Well, that's not bad too, but I'll be honest, I like the DeepSeek one better here. Talking about a tiny little helper, it's a lunchtime procedure, it seems a little bit more engaging to me. And so for the first question about patient education, I give 1 point to DeepSeek. What do you think? Do you agree? Comment below about what you think about these questions. Let's go back and let's tackle another question. This one is all about social media. And in this case, I'm going to ask DeepSeek, write an Instagram caption for a before and after photo of a lip filler treatment for a client. And let's see what we get. From subtle to stunning, swipe to see the gorgeous transformation of my amazing client. A little enhancement, a lot of confidence, some emojis, some hashtags. Pretty good, pretty straightforward. It's a little bit short in my opinion, but we'll see. We'll see what ChatGPT does. Let's throw that in the prompt box here for ChatGPT. Lips, but make them you. A little filler goes a long way when it's done right. This gorgeous transformation kept things natural, just a touch more volume, hydration, and definition for a fresh, balanced look. The goal, enhancing, not overdoing. The result, sculpted confidence. Ready for your own refresh? DM to book. All right. So again, I think this one this time has a little more engagement than this does. This is a bit short, and I like this one. I like the sculpted confidence. To be fair, I have trained my ChatGPT on the way I like it to speak, and so it is using some of that in here. And by the way, if you want to learn how to get ChatGPT to sound like your brand, I'll leave a card in the upper right corner and you can have a look at that. But I think in this case, if you agree, I'd like to know, but this is going to go to ChatGPT. 1 point for ChatGPT for the social media caption. All right. Let's go back, and now we're going to talk about some marketing. So in this case, I'm going to ask ChatGPT and DeepSeek the following question. Write a follow-up email to a scalp PRP patient asking for a review of my clinic. And let's see what we get here. Subject, we'd love to hear about your experience. Hi, I hope this email finds you well. It was such a pleasure having you at our clinic for your scalp PRP treatment. We're always striving to provide the best possible care, and your feedback means the world to us. If you have a moment, we'd be so grateful if you could share your experiences by leaving us a review. It helps us improve and lets others know about the care we provide. You can leave a review on, and it has a place here to put in the link. Thank you so much for trusting us with your care. If you have questions or need further assistance, don't hesitate to reach out, and it's got the signature area there. All right, pretty straightforward, I think, to the point. Let's see what ChatGPT does with this particular question. And this is what we get over here from ChatGPT. Subject, we'd love your feedback on your PRP experience. Hi, name. I hope you're doing well. I wanted to check in and see how you're feeling after your PRP treatment. Your journey to healthier, fuller hair is important to us, and we're here if you have any questions along the way. If you had a great experience at our clinic, we'd truly appreciate it if you could take a moment to leave us a review. Your feedback helps others looking for expert care and lets us continue providing the best treatments possible. You can share your shots. You can share your thoughts here, and you can insert the review link there. Thank you for trusting us with your care. I look forward to seeing you at your next visit. And then my name and the clinic info. That one's pretty close. I do like the fact that ChatGPT here talked about the journey to healthier, fuller hair, and it has the knowledge, has the intelligence to know that PRP treatment, that is what we are dealing with here. And so my personal opinion is I like the ChatGPT one better. Would love to hear your thoughts again, but this one I'm giving to ChatGPT. All right, let's move along and let's go to our next question. And this is one that's going to be a little bit more technical. I am asking it to draft a template that I can use for a Sculptra treatment for my EMR. And let's see what we can get. So draft a template that I can use for charting a Sculptra treatment in my EMR. And DeepSeek says, here's a clean and professional template you can use. Name, treatment, provider, treatment areas, product, lot number, dilution, total volume, anesthesia, pre-treatment assessment, patient concerns, medical history, procedure details, post-treatment instructions, post-treatment notes, next steps. So this is very direct, which is actually quite nice. I like that. I like that it's clear and it doesn't have a lot of extra words that I'd have to go through. Under the pre-treatment assessment, it talks about some things that you could be charting in terms of your concerns and goals and the history reviewed, consent, important, the technique, the type of needle or cannula or gauge, etc. So I like it. It's got post-treatment instructions. All right, let's compare that with ChatGPT. So let's throw that same prompt over here. Here's a structured template you can use. Patient name, date of birth, treatment provider, the provider, consultation and assessment, indications for treatment, previous Sculptra treatments, medical history review, patient goals, informed consent, treatment details, and then we go through the product, the total volume, dilution, number of vials, injection technique, cannula, treatment area, post-treatment instructions, assessment instructions. Ooh, this one's a tough one. They're similar, but they've got slightly different formats. So it depends. This one depends, I think, on your preference. I kind of like the ChatGPT one more, but I don't have any major problems with this one either. All right, I'm going to sit on the fence here. I'm going to give them each a point. So we've got ChatGPT to DeepSeek 3-2 with one question left to go. And this is probably another very technical one because one thing that we know about, at least in aesthetic medicine, is we don't want vascular occlusions. So what does DeepSeek have to say if we ask it, how do you manage a vascular occlusion that occurs during a nose filler treatment? Let's see what we get. All right, managing a vascular occlusion is a critical situation that requires immediate action. Okay, well, that's good. Here's a step-by-step guide. We want to recognize the signs of it. Okay, so it gives us some information there. Stop the injection immediately. Perfect. Aspirate if possible. Attempt to aspirate the filler. I'm not sure about that, but okay, that's interesting. Apply warm compresses. Okay. Administer hyaluronidase. Great. Talks about some dosing, some techniques, and then repeating it. Massaging the area. Monitor for improvement, and then consider additional measures. And refer to a specialist if necessary. If it involves the eye, refer immediately to an ophthalmologist or emergency department. Okay, that's good. Document the incident. Yeah, documentation, follow up with the patient, and future tips. Okay, it covers the basics there. Just don't know about if you can aspirate filler once it's been injected. That kind of has me a little bit concerned, but nevertheless, let's see what ChatGPT says for that. And let's throw that in there. How do I manage a vascular occlusion? And let's see what ChatGPT says. Requires immediate action to prevent serious complications like skin necrosis and vision loss. Here's a step-by-step guide. Recognize the signs. Pain, blanching, cool skin, delayed cap refill, stop injecting immediately, attempt to restore the blood flow. So firmly massage, warm compress, tap or flick the skin, administer hyaluronidase, dosing, techniques, increase the blood flow, aspirin, topical nitroglycerin, consider hyperbaric oxygen, monitor for signs of vision loss, ask the patient about vision loss, visual acuity test, if vision is suspected, 911, monitor closely, and prevention tips. They're both pretty good. I tend to like the ChatGPT one a little bit better. But again, depending on your style, you may like one or the other. So let's go back and let's give this a score. I kind of like ChatGPT. Should I sit on the fence? Even if I sit on the fence here, we've got 3 and 4. ChatGPT is our winner. Now, to give you a little bit of information about DeepSeek versus ChatGPT, they are both really, really excellent language models. I encourage you to play around with both of them. At the time of this recording, one of the big differences between DeepSeek and ChatGPT is that ChatGPT allows you to set up your custom way, your persona, your tone that you want the model to use when answering, which is a really, really nice thing. With DeepSeek, you can't do that as easily now. There are ways around that if you're using an API or that sort of thing. But just out of the box, it's not quite as simple to do that, at least currently. And so if that is something that is important to you, and the persona is something that you want to be able to portray in the content that is written, then I think ChatGPT is the way to go. ChatGPT, compared to DeepSeek, is also known a little bit more as a generalist type of model. When you think of it in terms of a medical analogy, ChatGPT is kind of like the GP, the family medicine, your family doctor, who does a really good job at lots of things. DeepSeek goes deep. It can use reasoning models. It can really hone down and get very, very specific in certain topics. So if you're looking for something that's very, very technical, kind of like your specialist, then DeepSeek may be better for you. Now, having said that, we tried these different questions, and I actually think overall, I liked ChatGPT. I liked the tone of it. It wasn't so much necessarily the content, but it was the style and the way that it presented its information. And so you will have to make your own decision. Make sure that you comment below and let me know which model you like. Do you use both of them? I use both of them. I think they both have a real benefit when it comes to my particular business in aesthetic medicine. And I think that you will probably find that there are things that you use one for and use the other one for other things as well. If this is helpful, make sure to like and subscribe. And I will be coming out with more and more tips very shortly. Until next time, take care.